COVID-19 mental health. Oh, can you hear me? Give me a wave if you can hear me.
Yep.
Brilliant, thank you. Hello, Dave. So, as I was saying, thank you for joining us today in this breakout session on COVID-19 mental health and the impact of the economy. My name is Jen Goddard. I'm the Associate Director of Strategy and Partnerships here at South West London and St George's Mental Health Trust. And I'll be your co-host today with Dave Moore, who's our Senior Public Affairs and Stakeholder Engagement Manager. Dave, I think you can hear us all there, so give us a wave, Dave, if you're listening. Brilliant, thanks, Dave. So we're pleased you're with us today to start this conversation. And before I introduce our panel, who are kindly here with us too, I'm just going to go through some quick logistics. So you should all be muted on your microphone, but you can choose if you want to have your camera on or off. However, we will be recording, so if you don't want to be seen or captured on camera, just switch your camera off. We do want this to be a really interactive session, so we are asking that if you are going to make comments or ask questions, please do that in the chat box live with Dave, and Dave's just pinged something up there, so hopefully everyone can see that saying, hi everyone, please send any questions for the panel to myself. So and we will try and get the panel to answer as many questions as we can. Do bear with us. If your question doesn't get answered, please be assured we have captured it. So with no further ado, I am going to go to our panel members one by one and just ask them to introduce themselves. So I'm going to unmute you as I do this. Justin.
Hi, my name is Justin Earle. I'm a consultant psychiatrist at South West London and St George's and the acting deputy medical director in the trust.
Thanks, Justin. And Richard. Richard Ellis. We'll come back to Richard. Aida.
Hi, can you hear me?
Yes, we can.
Hi, my name is Aida Eldewani. I work for the Department for Work and Pensions. I'm a disability employment advisor, and I'll be talking today about support offers from DWP.
Thank you, Aida.
I think Richard's back with us now. So, Richard, I don't know if you want to introduce yourself now. No, sorry about that.
Miles, can you introduce yourself?
Hi, I'm Miles Rinaldi. I'm the Head of Strategic Development at South West London and St George's Mental Health Trust.
And Sharon.
Am I there?
Yep, you're there.
Hi everybody, I'm Sharon Spain and I'm the Director of Nursing and Quality for South West London St George's Mental Health Trust.
And finally, Ian.
Hi there, my name's Ian Thomas. I'm the Chief Executive of the Royal Borough of Kingston and the Local Authority Lead for the ICS.
Brilliant, thank you all very much. So finally on our panel today, and who's going to kick us off, is Theo Shaw. Theo, are you there?
I am. Can you hear me?
Theo, yes, we can. Theo is a community organiser from Merton and Wandsworth who's kindly agreed to start today off by giving us a bit of a talk through her experiences supporting people in the community with their employment issues and how they may have impacted on their mental health. So Theo, thank you so much for being here. Can I ask you to please introduce yourself and kick us off, and then we'll come back to questions.
Yeah, thank you, Jen. My name's Theo and I'm a community organiser. I work for the charity Citizens UK. My patch covers Merton and Wandsworth, where I work with civil society institutions to create the changes that they want to see. I want to start off by just looking at the wider impact of COVID-19 on the workforce as a whole. I'm a mum. I have an 8-month-old son. He's with my sister at the moment, and I decided to come back to work during lockdown. And I myself have been gravely impacted by COVID-19, just thinking about how do you juggle home life and work life. And I recently read a research that said that women spend 80% of their time in lockdown whilst working with doing childcare business, which is what I do. So I have had, as with many parents out there, lots of times where I've sat down and cried and weighed up the option. Is it good for me to be working? Should I be at home? Is my child suffering? But also, if you joined the call a bit earlier, you would have seen me trying to comfort a baby. It's my cousin's baby, and she recently had a mental health breakdown, and I was contacted by a social worker this morning to say, can they bring him over? He's 6 months old. So I've got a baby who's here. Hopefully he won't cry. But in terms of my engagement with community groups and the impact that this has had on their employment, I recently had a conversation with a young woman who's a Black mom, single mom, has a 6-year-old son, and lives in a house that she's been completely upset with. And I think what COVID has done in terms of my engagement with community groups is really exacerbated pre-existing issues around housing, issues around poor access to mental health services, and so forth and so on. So not so long ago during lockdown, she took an overdose, and her 6-year-old son found her and called for an ambulance. Fortunately for her, she survived, but the reason for that being that she worked and was furloughed, was engaged in a local church and community life that was no longer, and then living in an accommodation that she has been complaining about for months, and probably on the cusp of some sort of mental health breakdown before COVID, but didn't have access to the services that she needs. So she took an overdose. And the impact that had on me to hear that, and to think that there's no hope for so many parents who are out there. And another person who I spoke to said to me, Theo, it's such a good thing that I don't live on the 7th floor trying to juggle working from home and childcare and homeschooling, because if I did, I don't know what I would have done. And all these stories really resonate with me, because I know I myself am a mum and I'm in that position. I'm fortunate enough to have access to good support systems around me to help me. But I also don't know, if I didn't have them, what my life would be like. And I fit the characteristics of everything. I'm Black, I'm a young mom. It's been dire. So there's lots of people who are worried also about jobs for people, businesses fearing the loss it would have, grandparents worried about, oh, I don't know what's going to happen to my son's job, my daughter's job, or my grandkids have just recently graduated, have just finished university or going on to university, and there are no jobs. So the impact is, it's there, and people are living it on a day-to-day basis. Thanks, Jen.
Thank you so much, Theo. That in a very short space of time, you've really gone through some of the major issues I think people are finding there. I'm going to open up to the panel. I mean, you touched on this young mother that you had this experience and her attempt at her life. Miles, Justin, is there anything you can tell us about the links between employment and suicide, just to start thinking about what we know from previous recessions and previous issues around employment? Over to Miles.
I just wanted to start by just saying thank you to Thea, actually, because that's a very real and touching story. I mean, I think the relationship is very, very clear. We know that things around kind of loss of employment, financial stresses are kind of well-recognized risk factors for suicide. When we look at kind of previous recessions and where people have looked at the changes in kind of mental health or just health before and after recessions, the findings are consistent and report basically a negative association with people's mental health and increased mental health problems. We kind of see that being played out through I guess a number of kind of different things really, psychological stress and distress, a much higher prevalence of common mental health problems, substance misuse, and ultimately for some, suicide. What are the kind of key, I suppose, what are the key factors when we're talking about the impact of the economy? I suppose that uncertainty of being furloughed or being unemployed, having a precarious work situation, facing debts and economic strain, and actually having a pre-existing kind of mental health condition.
Thank you, Miles. And I think that's it. I think Justin, I don't know from a kind of clinical perspective if there's anything else you would perhaps want to add.
Oh, I think Miles has definitely touched on a lot of things. From the evidence from the previous recession in 2008, there was definitely an increase in depression, increase in suicide attempts, and they noted that the reversal that we'd seen in suicide rates had actually reversed and went up, and actually it was in young males that it was more prevalent, at least after the last recession. But I think there is that evidence that people who are already experiencing difficulties, and Theo already touched on that, lots of issues are exacerbated, and that it becomes a double impact then. So you're already struggling with a number of issues already, and this then adds a double impact onto that, and increases that risk of mental health problems. They also found that in areas where there was the greatest level of unemployment, you saw the greatest rise in suicide and attempted suicide in the last one. So we know that these are risk areas. And I think the important thing is that we've got to be very aware of it. We know that people are furloughed, and the Health Foundation did a little bit of research early in lockdown and found that people who are on furlough were slightly less impacted. But we know that sometimes these furlough schemes are also have delayed the fact that a lot of people are going to be made redundant, and so the unemployment rate's likely to increase once the furlough period reduces. So we've got to be more vigilant about the impact that this is going to have on our and particularly our service users.
And I think that's a really important point about employment and furloughing. And we've had a question coming in around what are the simple things that each of us can do in our communities or local areas to support people who are struggling with mental health issues, particularly related to economic stress and unemployment. Aida, I wonder if you wanted to jump in here, because obviously this is your field around employment, and perhaps if you could comment on what you think those key things are we could do.
I think the main thing is to be aware of all the services that are around to support people with mental health conditions into employment, because obviously there's the Uplift employment specialists, there's the local access and recovery team employment specialists, but there are also lots of other charitable organisations that we signpost people to that often don't before lockdown were kind of not enough people were engaging, they were kind of underutilised. And I think really I suppose there ought to be more awareness of what's out there to support people, so that you can signpost people to the relevant organisations, because there is quite a lot out there, there's a lot going on, and it's about finding the right fit for the right person. I don't know if you want me to do my bit. When I come to talk about in my session, I'll talk a bit more about what investment is being made into employment support.
Yeah, thank you, Ada. I think perhaps I'd just like to jump to Ian, because I think actually picking up there on from services that local authorities provide, how they link in more going forward with, as you say, these things that people are signposted, don't know that they are there to be signposted to. Ian, what's your take on what we can do collectively and more collaboratively perhaps around some of these issues?
Yeah, so most local authorities have got really good connections with their voluntary sectors. Social prescribing is being used to great effect to ensure that people have access to support before the need for social care intervention or for treatment in hospital, say. So I think through social prescribing and working very working collaboratively in primary care, we can actually get to respond to people's needs quicker and intervene earlier, and also prevent needs escalating too. I think that we need to do much more work around diversification of opportunities. The economy is going to change, it's going to contract, but there will be some growth sectors. So I think across Southwest London, it's about understanding the hits on your local economy and responding to that. So speaking for Kingston, I know that we'll take a massive hit because of the contraction of retail and wholesale. And many of my jobs are retail and wholesale. 38% are retail, wholesale, and 38% are part-time situations, which will impact on young people and women the most, we believe. So it's about thinking about where the growth sectors are and working with further education and higher education establishments to ensure that there are pathways into employment, as well as our own adult education centres, of course. I think we need to encourage people to reskill, upskill, thinking about those growth markets, but also we need to work on financial inclusion with our colleagues in benefit support. We've seen a 500% increase in universal claims take-ups, so we need to be working very closely with them, and agencies such as Citizens Advice, who can provide support and advice around managing money. The other thing I've made a note of here is about clamping down on unscrupulous landlords, because again, we're going to see a threat to people's not just livelihoods but also their housing and housing quality. Clamping down on that will be also really important. And then the final thing I would say is, let's not you can't have a healthy economy without healthy people. So the community recovery piece and the economic recovery piece are inextricably linked.
Yeah, I think on that last point, we've had a question come in. I'll hand over to Dave to ask in the chat around healthy people and mental distress. Dave, do you want to pick that question up? Thank you, Ian.
Yeah, so thanks everyone for your questions that are coming in. So we've had a question from Helen, who says, how easy is it for someone who is suffering from mental distress for the first time as a result of the pandemic to find out the help that's available? For example, if you're applying for universal credit online, are there links that will lead applicants to mental health support if they need it? So it's around signposting, isn't it? So I wonder if a member of the panel would like to come in and answer that.
Go for it, Ida.
Well, as you're talking about universal credit, when you make an application for universal credit online, there is the question about disclosing a health condition. But I think more importantly than that, it's important for anybody that's making a declaration. If they speak to somebody, they can then. So I work with my colleagues in a job centre, so I cover Merton. And what a disability advisor does is that work coaches, when they're taking a claim from somebody, they then refer to somebody like myself, who can then speak to that person, find out what support they need, and get them signposted to the correct place. Obviously, we signpost, as somebody's just put, Ashley Painter, who I work very, very closely with, he's put self-referral into IAPT. But if somebody doesn't know that that's available, then obviously we would signpost to the right place. I have got a disability hub which includes all the mental health services in my borough, and I regularly update that and send that out to all my colleagues so that they're aware, so that when they speak to somebody, they've got kind of press a button and all the list of all the provision comes up, so they know to direct somebody to the right place. Also, when they go to make a commitment about what they're going to do to look for work, their mental health condition will be taken into account. So you might not be at this very moment ready to apply for a job because you might be needing some support with that. So we would first make sure that somebody got the help they needed before they were ready to, be showing that they were applying for jobs directly.
Thanks, Aida. And someone's also put, are there links with Job Centre Plus? Thank you to Stephen.
Yeah, that's us. Yeah.
Great. And so I think one of the things that Ian picked up on was around diversification of opportunities. And Sharon, I wonder whether I could jump in here to you to talk about, as a trust, not only thinking about mental health and well-being, but how we can provide employment opportunities as well going forward. as an organisation, and some of the programmes that are in place around that, and thinking about as a large NHS employer as well.
Yeah, thank you for that. And I think there's lots in that, isn't there? So I've been really struck through this COVID time also about how people who have never had mental health problems or issues before in their lives have suddenly been really just overwhelmed. And I've seen that in my own family and my own friends and my own neighbours. So I think that's been a really, really helpful conversation to have. I think when it comes to employment, absolutely, what we've seen, particularly in our local communities, is a real range of people who have got they've got the right care, they've got the right intention, they want to come and look after people who've got mental illness, they want to engage with the organisation. They might not have the skills or the abilities to undertake certain parts of it, but actually they have the right morals and the right ethics to come and look after the people in our community who've got mental health problems. So I think we are really, really keen, and we already have brought in a range of different people, from volunteers who we will train up, who can then come onto our bank. We need to start looking creatively about our different roles and how we're using people in our local community. How can people help us a bit more around, I think there's a lot of stuff with our faith groups that we could be utilising much better, with a lot more support across the communities and inpatient services. So I would be very open, and I work really closely with our occupational therapists and our volunteers that span across our whole organisation and our communities. So any ideas and thoughts around skills and abilities people have that need to be used, definitely I'd love to hear it.
Thank you, Sharon, because I think there's something around, as you say, the lived experience piece and ensuring people are working in appropriate roles. I think there was one other thing actually that Ian touched on, which Miles, again, perhaps I can throw to you, around young people and unemployment, and what some of the evidence is around young people and how this pandemic and furlough or periods of unemployment might impact people of a younger age.
I think one of the things we know from previous recessions is the kind of huge impact that unemployment, or just not, or being able to kind of finish your education and not make that natural transition into the labour market, actually has in terms of your long-term life chances. And certainly kind of what we know from previous recessions is kind of young people aged between 18 to 24, the longer their duration of unemployment, the worse their life chances are going forward. And that gets kind of mapped all the way through their 20s, their 30s and 40s. And when we talk about life chances, we're talking about their overall health, very physical health, mental health, but then when they do move into a job, their earning potential. And I think I'd just kind of like to kind of echo what Ian said around young people, that this is going to be an extremely difficult period of time. We're entering into probably the most considerable kind of impact that we've ever seen in our working lives on the labour market. And the more young people can do to kind of continue and further their education and set themselves up for a position when the economy starts to recover, the better their chances are going forward. I suppose just related to that kind of one of those previous points when we were just talking about, and it kind of strikes me that it was about that kind of what can we pragmatically do. And I was kind of thinking that there's something about kind of pulling together across maybe individual boroughs or across Southwest London, but just thinking it through in terms of what is the employment support offer to people who are experiencing kind of mental health issues or mental or kind of psychological distress. And I think Aida spoke around that kind of that step one, which would be the kind of universal offer, and really thinking that through with kind of the support from Job Centre Plus, the voluntary sector, social prescribers, things like Aim for Work, etc. And then the step two would be the employment support that's available across IAP services across the boroughs. That's for people with common mental health problems. And then what we know works for people kind of with severe and enduring mental health problems is the individual placement and support approach, to provide that kind of more targeted, intense support to enable people to kind of gain jobs, but ultimately to retain them.
Yeah, thank you, Miles. And I think Stephen in the comments has been saying there's large employment networks that we need to tap into around that, and thinking about how we offer placements and apprenticeships to young people. Ian, did you want to chip in? We've heard quite a lot about what's going on in Merton and Wandsworth, which is really helpful. How about in Kingston, some of these initiatives?
Thanks. I was trying to unmute myself there, Jen. Okay, thanks. So I wanted to just advise people that we do work collaboratively across South London, and we do have a chief exec lead for the economy, who's Jonah Greeny, the CEO of Croydon, and she's meeting with all of the growth directors across all of the 6 boroughs to look at the economy and the sort of the prospect for Southwest London. You know, what is it that we can use as a sub-region to attract inward investment, to accelerate construction, to look at emerging markets and become a position, a place where people want to invest in the future. The government talks about Project Speed, which is about, you know, accelerating and expediting construction projects, new schools, new hospitals, as we've seen in this area, and new housing. We have a large regeneration scheme in Kingston, which will signal the biggest social transformation we've ever seen in the Cambridge Road estate, that will create jobs. We have Unilever that has expressed a desire to make Kingston its home to its global HQ. And in those conversations, to give you another example, we are speaking to them about apprenticeships, you know, jobs for local people. But in both those schemes I've just mentioned, we talk about jobs for local people, but you have to look at housing as well. So access to affordable housing. So it's about how that whole regeneration piece comes together. And finally, I will say that we are blessed to have Job Centre Plus co-located with us. I think we were the first in London to have this arrangement in place here at the Guildhall, and it works incredibly well. We're proud to be a partner of Job Centre Plus. So, you know, the closer we can work together, the better and more responsive it will be for our communities.
Brilliant, thank you. So I'm hearing partnership working and collaboration is the way forward. Theo, if I could just come back to you and think about, in your role as community organising, we've seen as well, there's more stuff coming in the chat around the benefits of social prescribing, and obviously there are some really good links building up across all our boroughs. What could we do to improve some of those connections going forward and work together more collaboratively? What might help in your day-to-day? How would you think we could improve upon things?
I think that things are already somewhat improving in many ways, because there's that suddenly we are all far more connected in more ways than one. I think that for me, I've seen the institutions that I work with are far more involved in knowing what's going on out there. In terms of faith groups, they are far more active in terms of keeping contact with people in their congregation, vulnerable people in the parishes. So I think a lot has already been going on. There's a lot of partnership working that I have seen with both faith groups and non-faith groups coming together and identifying and supporting vulnerable people within communities. I think in terms of going forward is how do we retain that? Earlier on in the conversation, I heard about how do you maintain volunteers. One of the groups that works in partnership with another group, suddenly now lockdown is somewhat lifted, people are returning back to work and are in need of volunteers to deliver food to vulnerable groups, people who are still somewhat shielding in this time, maybe families with children. How do you get food to them? So I think continuing to identify where there is scope to work in partnership with local groups, localized groups that people generally find it easier to access. Faith groups, I think, for me, have been the most profound in terms of identifying and supporting people who are vulnerable, and they've been the ones to reach out to external organizations to say, okay, well, I've got this person here who's really vulnerable, I'm not sure if they've got food, how can I get food to them? So it's been, how do you maintain that, but how do you also scale that up in a way that we still continue to see the benefits of what a lot of people have somewhat enjoyed in lockdown? Because I think without those groups, the death toll, depression rate, it's bad enough as it is. I can't imagine what it would be like outside of that, because I know the role that those groups, those localized groups, faith groups have been playing in terms of supporting people. So yeah, I think maybe more collaboration with them. Yeah.
There's something about sustainability of that, isn't there, in terms of you know, not just the impact on employment and bringing those groups in to support their communities, but their sustainability as organisations as well, and how we can do more kind of public-private sector partnerships. I'm going to call on Paul. I think you're in the audience. I've had a question about some of the work you're doing in terms of the individual placement support. If I unmute you, Paul, are you happy just to just let us know a bit about that?
Yeah, that's fine. I haven't done much prep because you've just asked me a few seconds ago. So, basically, just before lockdown, we were, just for anyone that doesn't understand, the individual placement and support model, which Miles referred to earlier, is evidence-based supported employment practice that we've been running for many, many years in the Trust. We help people under the recovery support teams or the community mental health teams, the early intervention and psychosis teams, basically severe and enduring level of care. And we work closely with employers, developing relationships with employers, and we work with our service users to place them into a job based on their preferences. Just before lockdown, we were quite excited because we were growing, and we still are growing. We've got people in every borough in the Trust now. I know it's been a challenging time, dealing with a lot of furlough, dealing with a lot of crisis as such, and the employment market in itself changing. We've managed to continue functioning, and we are still getting people into work. And we are being very creative. We've got some of our team on this call, I can see. And and we lived through the last recession. Through the last recession, it was challenging, but with those challenges came opportunities. And especially when you're talking about the hidden job market. Yes, there will be unemployment and business going under in certain places of society. In others, businesses will continue to thrive. And as such, the main challenge we have is that continuing developing relationships with the community and local employers. And I won't go too much into the actual work we do, but it is the most effective model of its kind in the world. It depends on engagement with the employer, the clinical teams, and bringing all of that together. And as we come out of lockdown, we're already starting to see opportunities present. And as I said, we've still been getting outcomes even at the height of lockdown.
Thank you, Paul, and thank you for jumping in there. We've got a few more questions coming in, so I'm going to get these to our panel. So a question, I think maybe Sharon or Justin, someone's asked, where is the Trust getting the funds that it needs in order to meet the increased demand for services such as the ones Paul's just talked about, caused by mental stress, both by being experienced by children and adults during this time? And I guess some of that could be related to employment and the economy. Sharon, do you want to just tell us perhaps a little bit about the transformation work that's going on, or Justin?
I think we could probably be a tag team, Justin. I think it's really, really difficult to know, isn't it, what at the minute. I think we're so early coming out of lockdown. I think we're not going to see the true impact on what COVID has had across our local communities. I think we are planning for increase in our capacity, particularly around our younger people. And as I said before, people who haven't ever experienced any mental health issues in the past. I think that, yes, I think it is difficult. We are planning. Where the funding comes from is going to be another challenge, as it's going to be for all hospitals across the country, across the world, I imagine. Even our acute colleagues are in a really similar position. We've got lots of people physically deteriorating in our communities. They also have to prepare for an increase in demand. I don't know whether Justin wants to say a bit more about the actual the transformation pieces of work.
And I think the other bit that someone else has sort of added is saying, you know, what else can the trust do to help, I guess, thinking about transformation going forward, people who've been negatively affected by financial problems? How can we build more around kind of holistic, not just mental health interventions, but socioeconomic support into what we do? Justin, if that makes sense.
Oh, okay. I'll give it a try.
I
think it's interesting. I think the Health Foundation has done some interesting, have started some interesting work which looks at the NHS as an anchor organization. So because NHS organizations are quite fixed in their local communities, they can be people that look at employment opportunities, training opportunities, how things are commissioned on a wider basis. So there's some interesting work that's happening there, and that they're creating a network now of support. So perhaps something that might come out of this summit is that perhaps the organization wants to consider thinking of itself of how it can be an anchor organization in, you know, South London, Southwest London. And that then helps us think through perhaps how we can do things more holistically in terms of skills building, offering, you know, opportunities. Because often when people are recovering, I suppose, severe mental illness, you know, how they find their confidence again, and volunteering opportunities so that they can build their confidence to return back to work is really important. I think looking at community transformation, how our care pathways are more integrated, so that, you know, it's a start process which moves through a person's treatment and then helps them, doesn't just sort of end, but there's a clear integration back into community supports at the end of that pathway and at the beginning. So I think that's the kind of doing with community transformation at the moment.
Thank you very much, Justin. And I think everyone should now have something flashing up on their screens. Please don't leave your breakout session just yet, but we will. I think now is the time probably for me to wrap this up and say thank you very much to the panel, and also to Paul for jumping in. Thank you, Theo, for starting us off really with that kind of heartfelt opener. Thank you all. What we'll do now is when you want to, you can click on leave the breakout room. We have captured this session on video, so we will obviously be playing this back afterwards and going through all those questions and picking out all those really important points that have come in and in the chat as well, thinking about what we do next and really how we start to build some of this into our transformation work going forward. So if you have 1 minute now, thank you again, and you can now click leave breakout room. You should be taken back to the main room.
Thanks, Jen.
Just about everyone's gone. Thanks to the panel who are still here. And we've got one person who looks like they're still in the room.